Okay, slow deep breaths in and out. Feel a tiny poke here. Breathe through it. Good. Put all your energy somewhere else. Imagine you're someplace fun. What's a fun place for you to be? Maybe you're on a beach or enjoying a good book. Relax as much as you can. Around so I can see it. There are two ways to add volume to the lip. One is a submucosal injection. Enter the mucosa in the area of the lip where you want to augment and inject submucosally as you advance until you have the desired amount of volume enhancement. You can see the lip swelling as we inject here. Close your mouth. And you just do that several times to add volume. Second way to add volume to the lip is to inject 3 or 4 millimeters, enter 3 or 4 millimeters cutaneously superior to the vermilion. Inject with the needle until it's just barely starting to tent up the lip, as you see here. Withdraw until it's not tenting but flat. Then inject a bolus of volume in that area. And you can see that that's starting to tent that area up. So those are the two ways to add volume. When you do the bolus, you want to palpate the lip, see if there's any nodules in that area. Go ahead and add a little more. Close your mouth. Check this lip for volume. Open. We'll add a slight amount in this area. Slow, deep breaths in and out. Submucosal method is an easier method of injecting, but where you're really trying to add a significant, close your mouth, significant amount of volume to the lip, then you'll probably want to use the bolus method. Again, you don't want to overfill the lip, so it's better to close your mouth. Inject, stop injecting, check the area several times. Make sure that you have symmetry, that you've injected the same way on both sides, and so on. Turn you this way a little bit. We'll inject a little volume further along the upper lip. The other advantage of the submucosal method is that it will help smooth out some of the vertical wrinkles in the lip as well. And at least initially, you can also, for the first few days, if there are any lumps or bumps, you can have the patient massage these. You can clear them out of there. You can also have the patient rub their tongue across their lips. Some patients are very bothered by any nodules in the lip. So we've added a small amount of volume to the lips, to the upper lips right here. Generally, you want the lower lip to have more vertical height. So if the upper lip is, say, 40% of the vertical height, and the lower lip should be 60%. So once we've added volume to this lip, then you can see how we can add quite a bit more to the lower lip. Can you zoom out a little bit so we can just kind of show the effect there? So here's the lip area. And once the upper lip's been augmented, you can see how maybe getting to this volume in the lower lip creates more of a classic ratio of the upper to lower lip. Okay, let me get some more local. We're going to add volume to the lower lip next. So we'll enter mucosally and inject as we go. Try to create about 60% of the vertical height and volume in the lower lip area. You can also, rather than injecting all the way across the lip, you can also inject maybe just the middle 40% of the lip and create a lot of appearance of volume augmentation that way as well. So this lip is filling quite nicely. You can see we got a little nodule there. Just squeeze that out of there. We're not going to apply pressure over the bleeding points because sometimes that just causes the bleeding to accumulate a submucosal hematoma. You can see we've already added some volume to the lower lip, but she can do with a little bit more volume. Not a whole lot. We're getting close to the limit of where we want to be. So we're entering cutaneously. The needle is barely lifting the mucosa back out until the mucosa is flat, and then inject some volume in the lip. Do the same on the opposite side to create symmetry. Enter cutaneously, balloon up the mucosa, back off just a little bit, inject some volume in the lip in this area. Now at this point we have good volume and fullness to the lips. We've probably reached, or we have reached, our end point. Open your mouth. Good. You're going to feel in here for any nodules. You can kind of squeeze these out a little bit. Sometimes this will create bruising, so you want to be gentle, but reassure the patient. Close your mouth. Good. Smile. Excellent. To document the treatment, we've shown some cross-hatching here. Here's some fanning being shown. We did some depot injections in the lips. We also did some linear submucosal injections. These are all important in assisting you. Then we did 1, 2, 3, 4, 5, 6 linear threads in the upper lip. 1, 2, 3, 4, 5, 6 in the lower lip. That way we've documented our entire treatment. We've used 2 vials of filler, so we've put the little stickers right there indicating that, and we'll just put 2 vials of the filler. RTC, it usually lasts 6 to 9 months, so if the patient is mostly here for the lips, we'll see him back in 6 months for more filler. We'll have the patient apply some ice packs to the area. The area is going to feel sore for 3 to 4 days, as if the muscles are bruised whenever there's movement in that area. That's normal. Rarely patients can have massive swelling of the lips. If so, this can be treated with prednisone or a Medrol dose pack.